If you're not using an insurance agent and you're trying to find a Medicare Part D plan on your own, watch this video. I want to give you some advice so you don't make some mistakes. Hi, I'm Sylvia Gordon with the Medicare Family. 3 generations of agents selling Medicare supplements, Part D plans, and I want to tell you that we have a lot of experience with people that think they don't need an agent and they're fully capable to go and find a plan on their own. And ideally, that's what the scenario would be. You wouldn't need to get anybody involved and you'd be able to do it on your own. I mean, technically you could, but many times you don't understand all the criteria that come into play, and you typically reduce the whole thing down to, are my drugs covered? What is the price? And that's definitely a good starting point. But if you end up making a mistake, and many people do, your plans that you buy during the end of the year, during the annual election period, the last 3 months of the year, when you buy that plan, it won't start till January 1st. January 2nd, you go to use your card and you find out that you cannot get one of your key drugs. You made a mistake. And now you call an agent. You call me and you say, hey, I need you to switch me a plan. I know we can switch the first quarter of the year, and please help me fix this. The reality is the law as it stands right now will not allow you to change a plan. The first quarter of the year is called open enrollment period, OEP. And during that period, if you had a Medicare Advantage plan, you could switch to a different Medicare Advantage plan. You could make one switch. So if you made a mistake, we can figure it out right then at the beginning of the year and switch you to a new plan. But if you made a mistake with your drug plan, you don't have that ability to make one change. Now, it's something that our national organization that represents insurance agents, the NAHU, is working on up in Capitol Hill. We're working on it very hard to try to change that law so that you, the consumer, aren't stuck for a whole year in a plan that's wrong for you. Probably going to take years to get it changed. Eventually, we probably will get it changed because it makes sense, but it's not the law right now. So when you make a change for your drug plan for 2020, you're looking at the plans, call an agent. Call someone that is licensed, certified, bonded, insured, specializes in this, that can talk to you about behind the scenes, what goes on with that company, their customer service, how they've been to deal with in the past. Because if you have 5 drugs and you look it up and you say, oh, this plan covers my 5 drugs. Some plans are very, they've had a history of changing the list of their drugs. And if they change it after January 1st, they're within their right to notify you, give you 30 days notice, and they can change the drugs. You can't change. You're stuck without it. Some have a lot more barriers to getting your drugs, such as step therapy. You have to go through these steps before you can get your drugs. Or prior authorization. You can't get the drug unless you get authorized to get it. So there's lots of barriers to entry that you might not be aware of, that you might not understand all these little barriers to entry to the drug. And then you could have a different company, maybe with the exact same price, that didn't have as many barriers to getting the drug. So those are things that an experienced agent can bring to bear for you. It doesn't cost you any money to call us or email us at the Medicare Family and let us, give you a recommendation. You don't pay more to work with an agent. So I understand that, the Amazon effect. If you can do it yourself, do it and save money, I'm with you. I do the same thing all day long. But if you could have an agent bring that experience to bear to help you make this very important decision that's going to cover you for the next 12 months, and you won't pay a dime extra working with that agent, why do it alone? Why go it alone? Find an agent that you feel comfortable with. We'd be happy to help you. Call us, email us at the Medicare Family. Tell us what you're looking for, and let us shop for you. Thanks.